Hello everyone. In this video, we will talk about science of organophosphate poisoning. The mnemonic is dumbbells. D for diarrhea, U for urination, M for meiosis, B for bradycardia, again B for bronchospasm, E for emesis, L for lacrimation, S for salivation and sweating. What are organophosphates? We have to study the choline esterase inhibiting drugs, indirect acting cholinomimetic, which inhibit acetylcholine esterase enzyme. The acetylcholine esterase enzyme is important in the breakdown of acetylcholine. So by inhibiting the enzyme, we have potentiate or prolong the action of acetylcholine. These include carbamates, which have moderate duration of action, organophosphate, very long duration of action, Adrophonium, alcohol, very short duration of action. These drugs are acetylcholine esterase inhibitor. In the carbamates, there are numerous drugs which include the neostigmine, physostigmine, pyridostigmine, and benonium, while alcohol include adrophonium and organophosphates, which have very long duration of action, include parathione, malathione, serine, tubine, ecothiopate, natriphonate. Okay, the neostigmine is prototype of carbamate. It is representative drug of carbamate, while the prototype of organophosphate is parathione. The prototype of alcohol group, which include only one drug, is adrophonium, which is alcohol, not an ester. Mechanism of action: carbamate and organophosphate bind to cholinesterase and undergo prompt hydrolysis. The alcohol portion of molecule is then released. The acidic portion, carbamate of carbamates and phosphate ion of organophosphate is released much more slowly from enzyme active site, preventing the binding and hydrolysis of endogenous acetylcholine. As a result, these drugs amplify the action of acetylcholine wherever the transmitter is released. Adrophonium, although it is not an ester, while carbamates and organophosphate have property that their alcohol portion is released and the acidic portion is released much more slowly. So therefore preventing the binding of acetylcholine. Androphonium is not an ester, it is alcohol. It has sufficient affinity for the enzyme active site. So preventing the excess of acetylcholine for 5 to 15 minutes, very short duration of action. While the long duration of action is organophosphates. What are the clinical application of organophosphates? The clinical applications include specifically of carbamates. The carbamates have much more clinical application than organophosphate. The adrophonium has specialized significance that it is used in the discrimination of in the diagnosis of myasthenia and differentiation of myasthenic crisis from cholinergic crisis. What is myasthenic crisis? Myasthenic crisis is a specialized condition in myasthenia gravis patient in which there is antibody which destroy nicotinic receptors at neuromuscular junction and there is worsening of symptom. It is relieved by increasing cholinesterase inhibitor treatment. While cholinergic crises include the excessive activation of cholineceptor which causes weakness and depolarization, sickness, and paralysis of skeletal muscles, usually caused by cholinesterase inhibitor. Both are different terms, but both causes similar sign symptoms, that is weakness and paralysis of skeletal muscle. So atrophonium is used in the discrimination of myasthenic crisis from cholinergic crisis. How? We will administer short-acting adrophonium. After the administration of adrophonium, we will observe muscle strength. If the muscle strength improves, then it would be myasthenic crisis. But if weakens, that means cholinergic crisis. Cholinergic crisis. Okay. What is toxicity? Some cholinesterase inhibitor organophosphate have clinical importance because of accidental exposure to toxic amount of pesticides. Pesticides. The most toxic drug of organophosphate is parathione, which is para parathion, which is prototype at the most toxic fatal drug of organophosphate. And the antidote for organophosphate poisoning is atropine. But this drug has no effect on nicotinic sign because atropine only binds to muscarinic receptors. Nicotinic toxicity is treated by respiratory support and by regenerating active choline esterase. The regeneration of active choline esterase is done by another drug which is called pralidoxin. Pralidoxin. This may reverse both nicotinic and muscarinic effect, but there is some sort of aging. If aging occur, then the regeneration drug cannot longer remove the inhibitor. So before aging, we use pralidoxim, and the sign of organophosphate poisoning, which are actually due to excess parasympathomimetic effect, which include increased GIT secretion, which causes diarrhea, motility, urination by increasing the threshold of micturition reflex. Meiosis means construction of pupil. Bradycardia, heart rate will decrease. Bronchospasm, M3 receptors. Emesis, vomiting, lacrimation, and salivation because parasympathetic nervous system increases the secretion of glands. This was all about organophosphate. Hope you have liked this video. Please subscribe our channel. Stay tuned. Thanks for watching this video.